I'm Megan Girvin, Director of Nursing at Ameristaff Nursing Services, and your host today on Boomer Health at Home. On today's show, Keeping Seniors at Home, we're going to discuss the benefits of home care and how to keep your loved one safe and happy in their home. Today's special guest is a co-host of mine from previous episodes. Her name is Megan Girvin. You all know her. She's a home care expert and a registered nurse. Good morning, Megan.
Good morning, Maggie.
Thank you for joining us today and sharing all your knowledge and experience in home care and how to keep patients safe and happy in their home. So why is it important for families to get involved in this process?
Well, a lot of times it's actually family that comes looking for home care options. Maybe their loved one is falling at home. Maybe they live out of town. Like we have several, family members that live maybe in the Chicago area, New York area, and they, are very worried about their family members living alone, especially when it gets to a certain age. They have a lot of comorbidities that need to be watched out for, and they just want their loved one to be safe. A lot of times, that way we can actually report to the children that are out of town. We can fill them in on what's going on. And I think it's extremely important just to have your family in your care. They're there for a reason. They're your loved ones. And it's just extremely important to have them around.
So it's not just for, we need to keep eyes on mom. It's more of safety. We can do therapies in the home. Can you do therapies in the home?
You can do therapies in the home, physical therapy, occupational therapy, speech therapies, lots of different things that people don't think of when it comes to home care. I think a lot of people think of a nurse or an aide coming out to the home, and they kind of forget about those therapy aspects that can be done in the home as well.
Okay. So when one's going to start looking for a home care company, what are some good questions to ask, and what are some key things to look for?
So you really want to kind of do your research, because there are some companies out there that maybe they're not certified, accredited, they're not licensed. Recently, I got a phone call it was a little bit of a horror story. They found out that the home care didn't even have a registered nurse there. They were sending out their mother to care for the patient. And as the patient was worsening, they were trying to figure out what was going on. Turns out nobody was licensed there. So doing the research on the company itself, you can actually go on the michigan.gov site and check out businesses. You can check out the actual nurse that's coming out to your house and check their license to make sure they are licensed. Make sure they don't have anything against their license. The other big thing is to look and make sure what type of accreditation. I know our company, for example, we do CHAPS accreditation. We have somebody come in and make sure that we are up to standards. We are doing the best care possible. So I think it's extremely important to look for those things. It's important to make sure they're bonded, insured, that we do background checks on our employees to make sure that whoever is coming into your home is actually, safe to be out there. They're not going to be, stealing money or taking advantage of someone that's elderly and can't take care of themselves.
Okay, great. Wow, that's a lot of information. So thank you. But it's good to know, because you don't want, like you said, someone who's not licensed taking care of your loved one. I mean, the whole point of this is to give someone peace of mind and to help them heal in their home. And you just want to make sure you have the right fit there.
Yes.
So we get a lot of phone calls, inquiries about things like a private duty type of nurse, or some say private pay, and then versus, what does my insurance actually cover? A lot of people pay into Medicare. They pay into their private insurances. Are some of these services covered by your insurance?
So some of them are. So what the first, guide that we do is to actually have them reach out to their insurance provider and see what exactly they have paid for, what they paid into, what they have. And then a lot of times what we end up doing is wrapping the private duty around that. So say you have 3 bath visits a week that's covered by Medicare. Medicare doesn't usually cover 24/7 nursing. So say you need someone else there for the other times, or you want to pick specific hours. Unfortunately, Medicare, they're a little more, their hands are held by the government. They have to do certain things. They don't cover like the homemaker services that come into your house and actually help, clean up, take you to appointments, maybe attend social events. You want to go to a wedding, you want to go to a funeral, and you don't want to go by yourself. Maybe you like to go to church every week. It's having that type of stuff that kind of makes the difference. And, Medicare kind of sets the rules of what you're entitled to, whereas for private duty, you get to choose everything. So you can choose whatever is based on your needs, whatever you have come up. You can change those whenever you want to, which is really nice. It's not just, an agency telling you what you get to do. It's you telling us what we're going to be doing for you. You can actually choose your healthcare team. You don't like me, you get Maggie or one of the other nurses. So if we're not getting on too great. And I think the biggest thing too, you're always overseen by an RN, which Medicare agencies will do as well. We just happen to have a couple extra because of the private duty. You are paying out of pocket, you will get those extra services. It's kind of, what you pay for is what you get type of a scenario. We do still work with your doctor, whereas Medicare, you have to have a physician order. For private duty, you can actually just call us and we will come out to your home, assess your needs, help figure out what's going to work best for you. But you don't actually have to have a physician order, but we will contact your physician if you'd like, talk about your care, talk about your medications, and just keep everybody in the loop. We do all the work for you. We'll call your pharmacy for you and get your refills. It just takes a lot off your plate.
So it's kind of like a care plan based on that individual.
We wrap it and make it very personalized. I've put some interesting stuff on people's care plans when pushing it out for everybody. It's whatever's going to work for you, whatever you want them to know. Do you want their cat pet 6 times that day? Great, we can put that on your care plan. That's one of the other great things about staying at home is you get to keep your pets. And I'm a big dog person, so I would want my dogs there and to keep me nice and happy. Pet therapy is the real thing, right? Keeps you nice and happy.
Yes, it actually does. Pet therapy does work. I've read many studies on that. It's very interesting. So it kind of sounds like private duty is more of like a concierge home care. We kind of fit it to that individual, like we said, and we have them choose. So we give them more autonomy as well.
Yes, it's also kind of, so if you think about what a case manager normally does, a lot of people maybe don't know what that means, but we provide that service as well to where we will keep track of your doctor's appointments for you. We can even go to appointments with you, FaceTime with your family members during the appointment. So if they're out of town or something, we can, FaceTime them right in so they can be there. Again, notifying your doctor if anything's going on, calling your pharmacy. There's some people we keep their CVS profiles and do all their refills for them because that's what they've asked us to do. In terms of the aides that come out, I mean, they can do anything you want. You want some light housekeeping done, you want groceries, you want to run to the zoo, wherever you want to go, and just keep you nice and busy, make it so you're not stuck at home. Maybe you want to run to the mall and walk around. They can take you wherever you want to go.
And so I know we've talked about Medicare agencies and an agency like ours that does concierge private duty. Can we work together for a patient? Let's say they have Medicare and Medicare comes out 3 days a week, but they want care 7 days a week. Do you guys then get with the other providers and work copacetically?
We do. So if there's any other services in the home, I've actually had patients that actually had 3 services out in the home. We were the 3rd one coming out. They had, Medicare and hospice and then us coming out as well. And we just all talk. We get along together and, go through your care plan and what are they going to be doing compared to what are we going to be doing? So we're not, doing the same thing or maybe missing something that does need to be done. And a lot of times too, like say, I've had it to where a hospice nurse called me and said, I just can't get out there. I'm stuck in traffic. You're closer. So I can run out to the house and go check on the person and find out what's going on. So a lot of times if you just, it's all that being nice and working as a team. So it works out rather well.
Oh, that's wonderful. I do always say to my staff, if you do the right thing by the patient, you can never be wrong. And it sounds like that's what you guys are doing.
Yeah.
That's awesome. Okay. So Megan, to kind of wrap this up, because we've got some awesome information, is there any take home you would like our audience to know?
I think the biggest thing is knowing that just people aren't alone. I think a lot of people think this day and age, especially, people that are in facilities, we can still go into facilities. You guys aren't alone. We're there to support you and we can answer any questions you guys have. You can always call us. We're always available for phone messages. You just call 248-288-2270. We'd be more than happy to walk you through the process. And honestly, for our assessment, I'm not sure what other home care companies are doing, but for our assessment, it's free. We're coming out just to see how you're doing, what we can do for you, whatever's going to be best for you.
Oh, wow. That's wonderful. Thank you, Megan. That's really great information. Thank you for all you do, and thank you for providing this information today.
Anytime.
So, and to our viewers at home, thank you for watching Boomer Health at Home. I'm Maggie Arnasian, your host. I want to just say, if you have any questions, again, please don't hesitate to call us at AmeriStaff Nursing Services, 248-288-2270. Thank you. Stay safe and healthy.
My name is Greg Jamian, and I bring you our series on Boomer Health so we can explore together important healthcare topics impacting the baby boomer generation today. As a home health professional for over 40 years, I'm happy to share my team's knowledge as baby boomers seek answers to difficult healthcare questions. This show provides valuable resources, ideas and tips, and cutting-edge solutions that will improve your everyday life and health. Don't forget to join us for all the other shows in our Boomer Health at Home series.